Well, thank you everyone for joining. We'll be getting started in about another 5 minutes or so. Thank you. Well, good afternoon, and thank you everyone for joining us today. We're going to give another few moments for maybe some additional folks to join, and then we'll get started. Thank you.
Hey everybody, this is just a friendly reminder that throughout the presentation, if you have any questions, please click on the chat bubble and enter your question there. Neil will be fielding those questions at the end of the presentation to whoever they're directed to, and we'll be getting you those answers. There's also a Q&A that you can post your question that way. We'll be monitoring both. Enjoy the presentation.
Well, thank you, Lisa, and thank you everyone for being here. Good afternoon and welcome to Intermountains Healthcare's, formerly Healthcare Partners Nevada, Welcome to Medicare presentation. My name is Neil Finn. I'm the Manager of Broker and Community Relations at Intermountain Healthcare. Our team typically hosts and attends in-person events to connect with our Southern Nevada community and share the exciting things we're doing as an organization to care for our patients. Although we're not currently able to connect with you in person, we're thrilled to have launched virtual events to connect with you from the comfort of your own home. We understand that enrolling Medicare for the first time is a very important decision, and we appreciate you joining us today to learn a bit more about your Medicare options. We're joined today by sales agents Marlene Aguayo and Paul Kidd from Art of Medicare. Plus, in addition, we're also joined by Intermountain Healthcare Medical Director, Dr. Kilpatrick, to share information about our provider network and the managed care model at our My Generation Senior clinics. As Lisa mentioned during the presentation, if you have any questions and you'd like to address those at the end, please go ahead and click on the chat feature or Q&A. And so with that, I will go ahead and turn it over to Marlene to start the presentation. Enjoy. Thank you.
Hi, good afternoon, everyone. Thank you so much for joining us in this special event. And thank you so much for Intermountain Health that you have organized this for all of us today. We're definitely happy to be here. Lisa, next slide, please. So like you can see, and I want to introduce myself. My name is Marlene Aguayo, and I am joined by Paul Kidd. We are your local independent Medicare sales representatives for Art of Medicare here locally in Nevada. As you can see on the screen, both our names and phone numbers are listed for you to jot down and give us a call, or call us with any questions towards the end or even after this event. You can also visit us directly on our website at www.artofmedicare.com, and there's a lot of Medicare information on there that you can definitely take the time to look at and review. Next slide, please. As I had mentioned previously, both Paul and myself are independent Medicare representatives. There is a slight difference, and I want to just take this time to clarify that. We are not health plan sales representatives, which most of the time healthcare plan representatives are required to meet certain quotas and may only represent one company, whereas both Paul and myself, we are independent and we're not tied up to just one company here in Vegas, or depending on the state where we're approved. We actually represent multiple, and in our cases, pretty much mostly all of the plans here locally in Nevada. So we're able to offer them all to you. Next slide, please. Thank you. So what this means is that pretty much both Paul and I have no financial bias towards any one company. As long as your benefits and your costs are what you need them to be, then pretty much you, myself, and all of us are going to be happy. And a little bit more than that, it's that that we're not being steered or moved over to just one. We're able to offer all of them. Next slide, please. So both Paul and myself are here to help you understand Medicare and answer any questions that you may have. So our services are at no cost and no obligations to you. Always feel free to give us a call. Like any questions you have, just call us. We're not charging you. We're not paid by the hour. We are here for you. Next slide, please. So the agenda for today, real quick, I want to go over it with you. We're going to be discussing the 4 parts of Medicare, the role of a medical group, your Medicare options, the different enrollment periods that you have, the plan star ratings, what those mean. You usually see them at the end of the packet books for each carrier. And towards the end, the enrollment completion and questions. Next slide, please. So the 4 parts of Medicare, we have Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D. Medicare Part A is your hospitalization. Medicare Part B covers all your doctors. Medicare Part D covers your medications and or prescription drug plans. And I skip Medicare Part C because Medicare Part C is known as Medicare Advantage, and that pretty much consists of your Part A, your Part B, and your Part D. All those 3 parts are combined into one, which is your Medicare Part C, Medicare Advantage. Next slide, please. So your Medicare Part A is your hospital insurance. You may be eligible for your Medicare Part A. You may be eligible for a 0 premium if you've worked and you've paid your taxes for 40 quarters or 10 years. Okay, so most of the time, most of our clients and ourselves will not have a premium for your Medicare Part A. Otherwise, if you don't meet that criteria, you may have to pay up to $458 per month. Your Medicare Part A covers your inpatient hospitalization, your skilled nursing, home health care services, and your hospice. Next slide, please. So your Medicare Part B is what they refer to as your medical insurance. The standard monthly premium for 2020 is $144.60. However, for next year, it might go up a bit. Okay, so just be aware of that. The premium also does increase if your income level is over $87,000 per year per person. Okay, it's $174,000 for a combined married couple. Part B covers your doctor visits, your lab and x-rays, outpatient services and surgery, your ambulance, your ER, as well as urgent care and more. Next slide, please. Your Part B we're going to discuss the Part B late enrollment penalty. So if you did not enroll or for some reason have not enrolled in your Part B when you were first eligible, for example, when you turned 65, if you didn't enroll during that period, you do have another opportunity to enroll for your Part B. This is what they usually call the general enrollment period, which runs from January 1st to March 31st. That's another window for you to say, hey, I need to enroll my Part B. So that's an opportunity for you to go and enroll in your Part B. If you enroll during that general enrollment period, then your Part B coverage will become effective July 1st of that same year. Okay? Now, since we're talking about the Part B and late enrollment period, if you do not take that opportunity to enroll during the time you turn 65 or your general enrollment period, then the Part B premium is increased by 10% for each 12-month period that you were eligible for Part B but you didn't take it. So please be aware of that there is a Part B penalty if you don't enroll. However, there is an exception. You do not pay a late enrollment penalty if you meet certain conditions, such as having credible coverage that allow you to sign up for Part B during a special enrollment period. What that means is, for example, if you're working and you're currently working and then your employer provides you with credible health insurance, then there is no need for you to go and enroll in your Part B yet. Until you decide that you're going to retire and you're going to leave that employment, leave the credible insurance, then that's when you want to take advantage and go and enroll in your Part B premium. Next slide, please. So from here on out, I want Mr. Paul Kidd will be taking over the presentation. And if you have any questions, make sure you save them till the end, and both Paul and I will be more than happy to answer your questions. Paul?
Thank you. Thank you, Marlene. So as we see here, we're going to speak on the Part D prescription drug plans. Okay, so the Part D provides coverage for your prescription drug plans. Medicare beneficiaries who do not enroll into Part D and do not have credible coverage will incur a 1% late enrollment penalty. So it's very important that when you are eligible for Medicare, that you do sign up for your Part D drug plan, okay? Now, there are examples of credible drug coverage, like your employer coverage or group insurance, or maybe you have VA benefits or TRICARE. Those are examples of credible coverage, so just be aware of that. Next slide. Okay, Part D standard coverage. So there are 4 stages to the Part D stages. And so you have the deductible stage. So you just be aware that if you do have a deductible or not, it's very important to know that. The second stage is the initial coverage limit. The third stage is coverage gap, or what they call donut hole. And then the fourth stage is catastrophic coverage. So just be aware of those 4 stages and make sure to know if you have a deductible on your prescription drug plan or not. Next slide. Okay, the Part D initial coverage limit for 2021. So there is a coverage limit of $4,130. So this is where you are paying some of your prescription drug copay, and your health plan is paying the other portion of that you don't see. So it's very important to know that throughout the year, there is $4,130 that your drug plan is covering. Okay. After that, we're going to speak on what happens. Next slide. So if you surpass or if you exceed the $4,130, then what happens is you fall into a coverage gap or donut hole stage. And what that means is members will pay 25% of the negotiated price for generic and brand name drugs. Okay. So it's very important that you know if you do exceed that limit, that you're going to pay 25% on your prescriptions as far as generics and name brand drugs. Member will pay this until the catastrophic limit is reached. Next slide. Okay, so now here's the catastrophic limit. So you will reach a catastrophic coverage when your true out-of-pocket expenses reaches $6,550. For example, your co-payments during your initial coverage and your cost sharing during the coverage gap. So it's very important to know that there is a true out-of-pocket limit of $6,550 once you surpass your initial coverage limit, or the $4,130 in this case. After your yearly out-of-pocket drug cost has reached $6,550, you will pay the greater of 5% of the cost, or $3.70 for generic, $9.20 for copay for all other drugs. And if you have further questions, you can definitely save them for the end, and we can go more in detail, or you can reach out to me directly on that. Next slide. Okay, so this is the Medicare supplement plans. So Medicare supplement plans have helped pay for some or all of your expenses that original Medicare Parts A and B does not cover. So this is also known as your Medigap plans, as they say. So there are standardized benefits, and there's typically letters you see from Plan A all the way to Plan N. Okay, and those Medigap plans do have monthly premiums. And in all cases, your Medigap plans do not have credible drug coverage. So you will have to add in a drug plan if you decide to select a Medigap plan. Okay. So next slide. Okay, Part C, as Marlene was speaking on. So that's your Medicare Advantage plans. As she said, it's an all-in-one bundle, I like to say. So you have the Plan A plus the Plan B, and in addition to Part D, which includes or is equals the Part C, which is the Medicare Advantage. Next slide. Okay, the type of Medicare Advantage plan. So you have the HMO, you have the PPO, or the HMO special needs plan. Okay, so first we're going to start off with the Health Maintenance Organization, which is the HMO. So there's a network of doctors, a lab, and hospitals that you are committed to or connected to. Now, with the HMO, it does require a referral. Okay, so I want to make that very clear. If you decide that you're traveling or you're out of the network, you only have coverage for emergency care and urgent care. Okay, so if you're in California on a vacation, it has to be a emergency situation or urgent needed situation for your HMO to cover service area, which is Las Vegas. Okay, there is a medical group that provides coordination of care for your HMO plans. Now, the preferred provider organization is your PPO. Okay, so you have in and out of network coverage. Okay, so in that example, if you're in California with the PPO, as long as your provider that you are selecting in California takes the PPO that your health plan has, then you will have coverage there. Okay, and with the PPO, you do not need a referral. A referral is not required with the PPO option. Typically, you have higher premiums, deductibles, and higher cost sharing because you have the freedom to travel with your plan, and there's no medical group that you have to be committed to. Okay. Now, the HMO special needs plan is for individuals who have chronic conditions such as cardiovascular, maybe congestive heart failure, diabetes. Maybe you're living in a nursing home or long-term care or assisted facility. Okay, or maybe you have you're eligible for Medicare and Medicaid. So they do have some qualifying special needs plans for those recipients as well. Next slide. So the role of a medical group. Okay, so medical groups assist with the coordination of your healthcare. As an example, Intermountain Health. That's a medical group. Okay, so your chosen medical group will contract with different health plans. So there's multiple plans that might take your medical group that you have. And in most cases, you have your primary care physician that could write those referrals for you and remain in the same plan that you're changing to. So medical groups do determine your hospital network as well. So it's very important to know that. Next slide. Your Medicare options. So you have your original Medicare on the left. Okay, that's your Part A, hospital insurance, Part B, medical or doctors. And then you also have to add a Part D drug plan. Okay, and if you do want a supplement to fill in the gaps of Medicare, original Medicare is not covered, and you want to add in a Medicare supplement plan. The second option here is your Medicare Advantage. That's the Part A plus the Part B and the Part D. So it's an all-in-one bundle on those plans. Typically, there are lower out-of-pocket costs on those plans, and you also get additional benefits that Medicare, original Medicare is not covering, such as dental, vision, transportation, and so on. So definitely be aware of that. You do have additional benefits on the Medicare Advantage plans. Next slide. Okay, so with COVID-19 happening as of 2020, Medicare has responded with COVID-19 lab tests that you're not paying out-of-pocket cost on. FDA authorized COVID-19 tests, so that's really awesome now that they're doing that. And all medically necessary hospitalizations in regarding COVID-19, you do have coverage there as well. And when there is a vaccine available, you will have the COVID-19 vaccine coverage on your Medicare as well. So if you do decide to go with a Medicare Advantage plan, there are telehealth benefits which you have set up with your phone or your tablet or your computer that you can communicate with your doctor, or you also will have transportation on the plan in a lot of cases and meal delivery. So that's very important, especially with COVID-19 happening. Next slide. So important terms and definitions to remember in Medicare. So you have co-payments, okay? A set amount you pay for your medical services and drugs. Co-insurance, the percentage a plan charges for services you have to pay. That's very important. Appeal, a complaint you make if you disagree with a decision to deny a request for services or payment. And grievance, a complaint about the way your plan, doctor, office, medical group is giving care. So you do have those terms and definitions that are very important, especially when you're in Medicare, and you need to write an appeal. You know that you have that ability to do so, or if you need to have a grievance, you have that option as well. So that's very important. Next slide. Next slide, please. Okay, so your enrollment periods. Okay, so the first is your initial enrollment period. This is 3 months before you turn 65, the month you do turn 65, and 3 months after. Okay, so you have a 7-month window, and this is what we call the initial enrollment period. Now, the annual enrollment period is October 15th to December 7th. As you all know, we get the commercials in the mail and all that stuff. And so during that time, this is a good time to reconnect with your Medicare agent, if you have one, to discuss if there's any changes for the following year. Okay. Now, the open enrollment period, or OEP, this is from January 1st to March 31st. So Medicare does allow you to test your plan that you're on starting January 1st. And if you decide come February that this is not the plan option that you like, you can make one change throughout that time. Okay. And any changes that you make from January 1st to March 31st will go into effect the first day of the following month. Okay. So that's very important to know. You have that one option during the open enrollment period. Now, the lock-in period is April 1st to December 31st, and the special enrollment period, or special circumstances within the year. So if you have lost group coverage, which unfortunately a lot of people are losing their group insurance, you do have a special enrollment period that you have, and you can sign up for a plan anytime throughout that year. Also, maybe you're moving in from a different state or county, you have that option to sign up because that's a special enrollment. And there's many more other special enrollments, but I just wanted to highlight a few that you have in regards to your special enrollment period. Next slide. Next slide, please. Okay, so the plan star ratings. Okay, so every plan has star ratings. So it's very important that you know that CMS provides quality related information to help you choose the highest quality plans available in your area. So they do measure over 50 measures in regards to your prescription drug plan and the health plan as well. So it's very important that you know the star rating on the plan that you're selecting, because CMS does a thorough process and how they're grading your quality of care on that health plan. Okay, so the ratings range from 1 to 5 stars. And if you have further questions in regards to the star ratings on the plans, we do have Medicare.gov, www.medicare.gov, or your pre-enrollment kits. They will have that information. So it's very important to know that. Next slide. Okay, so at this time, I'm going to go ahead and turn it over to Dr. Kilpatrick, the medical director for Intermountain Health. Thank you guys so much.
Thank you. Very happy to be here. I'm almost 70, and if you're like me, you will really be happy when open enrollment is over, so there'll be room in our mailboxes for something besides literature from the various healthcare providers. I think we really would like to acknowledge how important the role your brokers play in keeping you informed and helping you make good decisions. We appreciate the opportunity to be here today, just to tell you something about our company here in town. Our homegrown company is Healthcare Partners. We're now part of Intermountain Healthcare, which is a larger nonprofit that delivers care in multiple Western states. In Las Vegas, we provide care to about 80,000 seniors that we've gathered up over the last 18 years. And we work with different insurance companies, including Humana, United, Select. We have grown progressively year on year for the last 18 years. Our culture is based on respect and service, and our purpose is to focus all our resources to help our patients live their healthiest lives possible. We do this by providing easy access to great providers when and where our patients need to be helped. Our center point is our 30 MyGen clinics that are spread throughout the Las Vegas area. We have about 140 primary care providers dedicated to our seniors. We have our own team of cardiologists, oncologists, endocrinologists. We also have our own urgent care and walk-in clinics. We have our own doctors to provide care for patients who need hospitalization. We have a complete network of specialists and super specialists that we feel real comfortable referring our patients to. All our primary care providers do virtual visits, which has been very useful during this COVID time when we're trying to keep people home and safe. We have about 10 providers that do nothing but go to patients' home and make home visits when needed. And this might be after a hospitalization, say for a hip replacement, or it might be for someone who has chronic illnesses where they just can't leave their home. Next slide. Next slide. And that slide, we are sponsors of the Raiders here in town. We work with them at their training facility. We have a lot of fun doing that. Next slide. And okay, so that really describes what the capacity that we have. Next slide also, please. And this is what we do. We deliver our care in what we call a total care model or population health model. And the important thing to take away from here is that we have a lot of services that we're able to provide at the clinical level. And all of that is focused on the patient. And the thing that to take out of this slide is that the middle of the slide is our patients. And that's where all our efforts are dedicated to. Next slide, please. All right. So we deliver our care in our MyGen clinics, which are special concierge clinics for seniors that really require no extra cost to join. These clinics are designed strictly for seniors and staff with teammates and providers that have special skills related to seniors, but also have chosen these clinics because they enjoy working with seniors and they enjoy the satisfaction they get from helping senior patients. And I think that's an important distinction. We realized early on in taking care of senior patients that the needs are different, that they require some support that other folks might need. We like bright, well-lit clinics. We like well-spaced clinics. We like clinics that have exam tables that are easier to get on. We like clinics that are well-staffed with enough people to take care of folks who need to be pushed into their room and need assist getting on their exam tables. The whole system is designed for seniors. And also we exclude, we don't have any pediatric people. We don't have younger people in the clinics. And so they tend to be quieter and just a little more peaceful place as well. Each of these clinics, we like to keep them small. We have 30 of them spread out throughout the valley. Each clinic has about 3 providers. Each provider only has about 750 patients assigned to them. And that really does allow for an awful lot of personalized care. The providers are not rushed. You have time to get the care that you need. Our goal is to build strong relationship between our clinics, providers, and our patients, and provide what you need when you need it, so that when you get in a jam, that you'll call us, and hopefully we can help you early on in whatever processes that you're dealing with. Each clinic has case managers and navigators to help our seniors through the maze that medical delivery is these days. Our focuses on patient education, because we want our patients to be informed, and we really think it's important for patients to be a strong participant in all the decisions regarding their health care. And you can only make informed decisions when you have all the information. And so we spend a lot of time talking with patients and try and get patients to help make their own decisions and make good decisions. We've grown year over year for the last 10 years with patients, and we continue to grow. And I think we do that because we really do focus on patient needs, and we hire teammates and providers who have the same kind of feeling that we do, and they enjoy taking care of people. They come to work with a joy and a purpose, and I think we all enjoy what we do, and I think that makes a huge difference in satisfying patient needs. We welcome all feedback on the care that folks get, because we really want to meet the high expectations that our patients bring to us. That's all. I just hope you'll consider us when you're comparing various provider organizations, because we really are focused on seniors, and we really are able to provide the level of care that you deserve. And that's all for me. Thanks.
Great. Thank you, Dr. Kilpatrick, and thank you, everyone, so far. I don't see any questions yet, so just as a reminder, anyone would like to add some questions, please do so in the chat button or the Q&A section. We'll be happy to answer any of those questions. So we'll give another moment or two to see if anyone has any questions.
Hey, Neil, this is Paul. I do see Howard. I don't know if you got that one.
I'm not seeing it. Do you see that, Lisa?
I'm not seeing that as well. Could you go ahead and build that for us?
Neil, would you like me to read the question?
Please, if you could, Paul. Thank you.
Yeah. Okay, so question from David Howard says, what is the HMO DSNP? And does Intermountain Health or Intermountain, my generation take it? Aetna HMO DSNP. So what is the HMO DSNP? So the DSNP is the dual special needs plan. So maybe some members, depending on your level of extra help, you could qualify for full Medicaid and Medicare, which will be considered a dual SNP. And Intermountain, from what I understand and aware of, they does not accept the Aetna HMO DSNP. So Intermountain Health does not accept that as well. And he says, I used to get Quest diagnostic report with healthcare partners. I don't anymore. Yeah, I'm not sure why you don't get the reports anymore, but as far as the DSNP with Aetna, my generation clinics will not accept that with Intermountain Health.
Thank you, for Paul. Dr. Kilpatrick, did you want to clarify or add anything to that question?
We do not work with Aetna at this particular time. There are multiple other SNF programs with multiple other covers that we do take, and so have your agents do a little bit further investigation for you and give you some options and alternatives. And I think probably one of them would include health, Intermountain Health, but I can't tell you. There are 2 or 3 other SNF programs. Aetna is certainly not the only one, and we've chosen just to focus on with certain provider or certain companies because really we can't be everything to everyone. But I do think we do take some SNF products that hopefully Paul and Marlene can help you get to.
Great. Thank you, Dr. Kilpatrick. Yeah, and please let me know, Paul or Lisa, if you see any additional questions. I am not seeing any. Just give it another moment or two.
Hey, Neil, I do not have, actually I do. There's a Q&A, and it says, as a federal government retiree, I have group FEHB insurance. What do I need to do to transition to Medicare?
Paul and Marlene, would you know the answer to that, or?
So let me recap. So they have retiree insurance, but they want to know what they will have to do if they're going to transition into Medicare. Is that the question?
Yes, I'll repeat it. As a federal government retiree, I have group FEHB insurance. What do I need to transition to Medicare?
Okay, so what we need to do is definitely we want to reach out to your group retiree insurance to just be aware of what you have currently. And if you decide that the Medicare option is a better fit for you, then we will have to essentially go ahead and look at some Medicare plan options for you. And when we do that, it should notify your retiree insurance that you will no longer be on their group retiree plan. So once you transition into a Medicare plan outside of your retiree group insurance, then you do have to be aware that and typically you can't go back to your group retiree insurance. So it's very important to know that once you transition out of your group retiree insurance, then typically you can't go backwards. So we want to make sure that we see what you have, and if you're not happy with that group retiree insurance, then we could look at some other plan options for you that could be a better fit.
Yeah, and if I can add to that, definitely what would be really important is for him to contact his the broker direct or one of us, because when he has a federal retirement, their benefits are most of the time are superb, and we don't want to remove him from that benefit that he currently will be given by him retiring. So sometimes it won't even behoove him to obtain, not obtain Medicare, but go on a Medicare Advantage plan, but actually stay on his plan. So that's why it's important that he builds that relationship with that broker or with one of us so we can help guide him, because we do not want to pull him from something that is a great benefit. Because like Paul mentioned, he might not be able to go back to that again. So we really want to be careful and have him just to speak to somebody that's very knowledgeable about that.
Great. Thank you both.
Hey guys, this is Lisa. I'm going to ask that all the panelists open up their chat and check. I have somebody who's posted in the Q&A that they have sent a chat that it's not in mine, so it could be in any of yours. Please check. Okay, I see the problem. I think all the chats we're not able to see them. If you have those questions, could you put them in the Q&A so that we can see them? Here's a question. Is a move to another state qualifying event for change?
Hi. Yes, that is a qualifying event for a special enrollment period. So if you move from Las Vegas to another state or even up to Reno, that does qualify you, and you can go ahead and enroll for whatever that county itself offers.
Great. Thank you, Marlene.
Thank you. I do have another question. Is the information from the presentation available on a website?
I'm sorry, Lisa, do you say, is this presentation available on the website?
Yes, is the information from this presentation available on a website?
Well, I believe we will be recording this for someone to view it. So look at the information there. You would certainly have that option to revisit this presentation. And of course, you have the avenues of reaching out to Paul or Marlene as well for any additional follow-up questions.
Yes, that's great. And also, just as a reminder, a lot of you have probably received this book. This is a Medicare Bible. And if for some reason this video is not available, always refer to the Medicare and You handbook. And a lot of the everything we covered is pretty much from that book. And it'll explain a lot, pretty much like A, B, C, all the 4 parts of Medicare. It'll give you at the end, I think it's at page 120, all of the different carriers that are here locally or in your county, and give you pretty much like a comparable of what the benefits are. So just so you're aware, okay?
And I do have one more question here. What is the time frame of becoming Medicare eligible and going a My Generation clinic, i.e. lead time to join? Last time I was kicked out of a clinic due to underage of 65, and it took 6 months to get an appointment.
Well, as far as the appointment, you shouldn't have. I'm sorry to hear that you had that difficulty. If that was with one of our clinics, but with the My Generation clinics, as in the presentation that Dr. Kilpatrick did, Any new patients to that clinic will be seen within 2 weeks, and any follow-up visits will be seen within 2 days. So we always try to get in patients when and if they need that care. So that is certainly, we're very cognizant of that, and we certainly try to make sure that we are able to get you in when you need so. Was there additional part of that question that I didn't address that maybe Paul or Marlene can answer, Lisa? Or did I answer that question?
I think you got it.
Okay, very good. Thank you.
We do have some more.
I do see one question here, Lisa. Does your organization work with Southwest Medical Associates? No, that is a different medical group. So we are separate medical groups. So the answer to that question would be no.
And then we have, we had Healthcare Providers of Nevada that has now transitioned to Intermountain Healthcare, but Intermountain has sent nothing detailing a change. How do we find out what has changed?
Well, we did send out letters some time ago when the transition did occur. As far as a patient perspective, I wouldn't see as much change as your everyday visits to doctors and your accessibility and be able to continue to see those doctors. You should be able to go ahead and continue to enjoy seeing those doctors. If there's anything specific you have a concern about, please note that. But as far as patient perspective, you should be able to enjoy the same services and benefits that you enjoyed while you were with Healthcare Partners. And I see a question here, Lisa, as well, from maybe Paul or Marlene. How or where can I obtain the Medicare and You handbook?
The Medicare and You handbook can be retained either through Social Security, or we could also email you a copy of that as well. So either way, usually typically through Social Security, you can get that Medicare and You book, or obviously calling Medicare, of course, or we could send it to you directly if you give us your email address. And Marlene, if you want to add anything else there.
Yes, no, you pretty much nailed it. Contact Medicare or go online to medicare.gov and, get the number there. I believe I have it. If you give me a minute, I think I can obtain that in a few minutes. Or if not, just put your email or contact Paul and myself, and we will be more than happy to email you the book itself. I do have it in English and in Spanish, and they do offer other languages as well. So that way, any questions you have, it is clearly explained in that book.
Great, thank you both. I'm not seeing anything additional, Lisa. Let me know if you are or when you are as well.
I believe we have answered all of the questions. I wanted to give a special shout out to those of you who retyped questions in the Q&A while we were shuffling through finding all the questions. I really do appreciate your help today.
Thank you. Okay, so if there are no further questions, we do want to thank everyone for joining us today. We hope that you continue to stay safe, and we look forward to seeing you at a future event. Thank you, everybody.